So we'll continue talking about fluconazole, and namely we are now focusing on the drug interactions of fluconazole capsule 150 milligrams with other medications, other treatments. So the fourth category is cisaspiride. So cisaspiride increased the interaction between fluconazole and cisaspiride is noted to cause an increase of ventricular arrhythmia, especially torsade de poids. And this causes the interaction between fluconazole and cisaspiride causes a significant increase in the plasma concentrations of cisaspiride and leading to prolonged QTc interval. So it is contraindicated to give cisaspiride in patients receiving fluconazole. So patients who are on fluconazole shouldn't be started on cisaspiride. cisapride, cisaspiride. Okay, cyclosporine. So fluconazole slowly increase cyclosporine concentrations in renal transplant patients. But fluconazole did not affect the levels of cyclosporine in patients with bone marrow transplants. And it is recommended to monitor the plasma concentration of cyclosporine in patients receiving fluconazole. Okay, next we go to hydrochlorothiazide. The interaction between multiple doses of hydrochlorothiazide and fluconazole has increased. It has been shown to increase the plasma concentrations of fluconazole by 40%. But the good thing is you do not necessarily have to change the dose of fluconazole. Even though there is an increase in the plasma concentration with hydrochlorothiazide, but you don't necessarily need to change or adjust or reduce the concentration of fluconazole. So this change is not that significant clinically. Next is oral contraceptives, OCPs. It is shown that multiple dose of fluconazole is unlikely to have an effect on the efficacy of the combined oral contraceptive pill. Phenytoin. So next we're talking about phenytoin. So giving fluconazole together with phenytoin may increase the levels of phenytoin significantly. So this is significant clinically. So if you want to administer, or if you want to give both drugs concomitantly at the same time, then you should monitor the levels of phenytoin, and the phenytoin dose should be adjusted accordingly to maintain the therapeutic levels if given with fluconazole. So the ninth drug category is pimozide. So giving fluconazole with pimozide may increase the risk of ventricular arrhythmias, especially torsade de poids. Next is rifabutin. So the interaction is that there will be an increased serum levels of rifabutin. And there have been reports of uveitis in patients given fluconazole with rifabutin. So patients receiving rifabutin and fluconazole at the same time should be carefully monitored. The next one is rifampicin. So giving fluconazole and rifampicin has been shown to result in a 25% decrease in the AUC and 20% shorter half-life of fluconazole. So this is probably because the rifampicin increases the metabolism of fluconazole by induction, and therefore we need to increase. We might want to consider increasing the dose of fluconazole if given with rifampicin, which is an anti-TB drug. Next is sulfonylureas. Fluconazole has been shown to prolong the serum half-life of oral sulfonylureas that are given concomitantly. So oral sulfonylureas include clopropamide, glibenclamide, glipizide, and tolbutamide. So this prolonged serum half-life has been seen in healthy volunteers. Okay, this study was involving healthy volunteers that were given both sulfonylureas such as glibenclamide together with fluconazole, and from that study they saw that the serum half-life of fluconazole was seen to be prolonged. Fluconazole and oral sulfonylureas may be co-administered to diabetic patients. Okay, you might give fluconazole and oral sulfonylureas in diabetic patients, but we need to bear in mind that the possibility of a hypoglycemic episode. The next category is tacrolimus. So the result when given concomitantly is that there is an increased serum levels of tacrolimus, and there are reports of nephrotoxicity. Therefore, we need to monitor the patients when they are given tacrolimus together with fluconazole. As with regards to tafenidine, so giving fluconazole with tafenidine causes palpitations. So you can see palpitations, you might see tachycardia, dizziness, and chest pain. However, the relationship of the adverse events to the drug therapy or underlying medical condition was not clear when the study was done. So they couldn't draw a clear conclusion to the relationship between the adverse events to the drug therapy or underlying medical condition. And because of the potential interaction that is serious, so it is recommended that patients should not be taking tafenidine together with fluconazole. The theophylline, so this is the second last one. So patients who are receiving a high dose theophylline or patients who have increased risk of theophylline toxicity should be observed for signs of theophylline toxicity if they are receiving fluconazole, and therefore you need to modify the therapy appropriately if signs of toxicity develop. With zidovudine, so lastly, with regards to zidovudine, we have seen increased levels of zidovudine when given concomitantly with fluconazole, most likely because of the decreased conversion of zidovudine to its major metabolite. So that's the action of fluconazole. So fluconazole may inhibit the conversion of zidovudine to its major metabolite. Therefore, you need to monitor the patient for possible development of zidovudine-related adverse reaction. Miscellaneous reactions: use of fluconazole combined with estomizole or other drugs metabolized by the CYP450 system may be associated with elevations in serum levels of these drugs. And with regards to giving fluconazole orally with food, cimetidine, antacids, or following total body irradiation for bone marrow transplantation, there were no clinically significant impairment of fluconazole absorption. So there's really no problem with fluconazole with regards to food. Okay, you can take it before or after food. Okay, that's all from me for the series, 3 series of talking about fluconazole 150 milligrams capsule. Okay, we'll see you in the next video. Thank you. Bye.